From my experience, I am sure that patients are not interested in any system. They are interested in result only. Whatever system it may be, whether Ayurveda, allopathy, homeopathy, they won't mind. They need results without any side effects, without any adverse effect in future or even at that time. That is their necessity. So usually what I do, for the benefit of that patient, which is better, that I will recommend. In general, I can say there is treatment for almost 99% of eye disease. And then I will give a discretion which will be better for that person, that particular person at that particular time. There will be a role of time, role of severity, role of chronicity. These are all to be considered. On that basis, I will take a discussion and I will convince it to that patient. That time there is an option like this, which one you prefer. If it is like this, it will you have to take this risk, or in this, if you are coming to Ayurveda, it may take some time like this, but you will have this type of advantage. So the patient will take a decision by themselves. That is my method. For example, for a cataract patient, if it is already matured, and in that stage, in Ayurveda also it is recommended to do surgery, and very good surgical method also is prescribed. Now the method is modified and advanced and come to even intraocular lens implantation like that. But there is medicinal approach just before becoming it maturity. So there is medicinal treatment in Ayurveda. But most often what happens, patients are coming to Ayurveda saying that doctor has prescribed surgery but I won't like it. Can you treat it with the medicine? At that time I will not take it. I will say there are methods, it will take time and sometimes it may be lifelong, but you have a better option, surgery. Since I am not doing it, it doesn't mean that this is the better. So at that time I will recommend them for the surgery. Because in my opinion, patient deserve the best. That is the base of any treatment. Any doctor should be ready for that. Which is best for that particular patient, for that particular time. That should be advice for him. I will follow that theory. So I am not doing a surgery in our hospital just because I am not that much trained in that field, and the facilities are not at all prepared, arranged for that. So we are handling cases in which we get maximum results in medicinal approach. So different types of degenerative conditions are a great problem nowadays, just like macular degeneration or different types of other retinal degenerative conditions and the complicated stages of diabetic retinopathy or retinitis pigmentosa. These are still beyond the reach of surgery or any other modern technologies. So there are various scientific level of treatment procedures in Ayurveda to maintain the vision of that patient and to protect that vision of that patient and to arrest the progress of the disease and thereby give that patient a chance of a happy life. For such patients, I will recommend Ayurvedic approach, because there also I will try to convince this is the method in Ayurveda how we handle and what result you will be gaining. Then they will be happy. And again, there is another group of patients whom most often that happens in my experience. The patient may be trying one system, whether it is Ayurveda and allopathy, whatever it may be, and they are not getting the desired results. Then they will be searching for another system. In that situation also I will recommend them for Ayurvedic approach, because you can do like this. Then another situation is there when there is two options. Suppose one is medicine and another is surgery. Then I will recommend them to do medicinal treatment first, because in any surgery they are doing an anatomical change which is permanent and irreversible. It cannot be brought to previous stage after that treatment. and suppose the patient is going for the medicinal approach first, and the worst case scenario, they are not getting the results. Still then, this other option, the surgical option is still there. They can go for that in the, later. There is no any restriction for that surgery. On the other hand, if the patient is going for the surgical approach first, and in the same way they are not getting the desired result, the worst case, then the chances for the second option, that is medicinal approach, is very, very less, because the structure is not intact in their body. So, if it is not a very critical stage or very dangerous stage, then I will advise them to go for a medicinal trial first. And if they are not getting the results, they can go for the second thing also. That is my opinion. This is not the case with eye disease or our hospital or anything like that. This is my personal general opinion, because I have met with so many cases like that. So, they give them a chance, let them have a chance, which is without any problem, without any adverse effects, then that is the best option anyway. And in many cases, they were able to save their eyes and to protect their vision by this approach. Of course, I will recommend like that only.